Is there a role for gratitude at a time like this? Obviously, I think everyone in the world right now is extremely grateful for healthcare providers. They truly are on the front lines. They're putting themselves at risk. What is the role for gratitude, though, at this time?
Oh, there's a tremendous role for gratitude. Eckhart Tolle says that if there's one prayer that we say during our lifetimes, in order to really find that contentment and inner peace, if there's one prayer, it ought to be thank you. So this practice of gratitude, I've woven it into our morning meditations. We have a Wellness Wednesday morning meditation. It's a 15-minute meditation between 8:15 and 8:30 that I share with the entirety of the health system. And gratitude is a central pillar of that practice. Just taking a few moments each day at a time that is convenient for you in order to express gratitude for the people in our lives, for the support network that we have, for our friends, our families, our coworkers, even, and all of those people who are coming together to help us surmount this crisis. I'm grateful for the fearless scientists, all of the people who have been, conducting research internationally that give us some ideas with regard to what's going to work in order to get through this and help our patients get through this. So an outpouring of gratitude is a great practice, and for those individuals who really enjoy journaling, really writing that down. It's a really nice practice to put pen to paper and just reflect for a few minutes about 3 things every day or every evening before you go to sleep. What we're grateful for, and that practice of doing that day in and day out, it actually has been clinically proven to improve our happiness and our feelings of contentment. So there's a tremendous role for gratitude in this, and again, I think that we're going to come out even stronger than we went into this.
Thank you so much. Is there anything else you'd like to add before we end our Skype chat?
I think that it's just a reaffirmation of our routines, and sometimes when we are in the trenches of healthcare and incredibly stressed out, really creating a space when we come home is a very important practice. So I've heard a lot of people just share this, very, very spontaneously. People have come home, they've shed their scrubs, the scrubs go like directly into the washing machine, they take a shower, and then they kind of come together. Then their families are allowed to interact with them, so there's that little space where they're allowed to decompress and de-stress after a very stressful day. I think that that's a really nice practice. We can all establish our own little, coming home routine, so we leave that stressful energy, where it needs to be outside of the home, and we can really connect meaningfully with our loved ones at home. And using a devotional practice or a mindfulness meditation as part of that kind of, coming home decompression routine is a really nice practice. And remember, rest, hydrate, meditate, exercise, and really ask for help before you might need it. If you just keep these simple, principles in mind, I think that we're going to do just fine during this.
Great. So rest, hydrate, meditate, and ask for help when needed.
You got it.
Great advice. Thank you so much, Dr. Mehta. We really enjoyed talking to you today. Stay healthy and stay safe.
You as well. Thank you.
Take care.